Welcome to the first module of and first topic of our Wilderness First Aid, CPR, and AED class. We're going to go ahead and just start with what we do before we even start to deliver care. So before giving care, we have to ask ourselves a few key questions. First of all, we want to recognize an emergency and how to respond to that emergency. They're the 4 actions. So, recognizing that an emergency exists, deciding to act or not to act, activating some sort of emergency system, so contacting EMS, paramedics, 911, and then giving care with the consent of the person until EMS arrives. Now, this is going to be slightly different when we get to our wilderness scenarios because we won't have as quick of access to gear. But for now, let's start with front country, okay? Let's go ahead and watch this video.
Can you believe they're catching the game last night?
It was amazing. I thought it was over. I was ready to turn the TV off and go to bed.
Yeah. They got lucky. They had no business winning that game.
Look, a win is a win.
Yeah, right. Oh, check him out. That guy looks like he was out on the field.
Seriously, though. You think he's okay?
I would assume so since he's out and about, but how can you tell? Hello? I gotta get to the office.
Yeah, me too.
Yeah. Okay. We'll get those documents over to your office later today, then we can discuss where to go from there. Sound good?
Help! Help! Dad, are you okay? Help! Dad, someone help my dad, please.
Sir, are you okay? Sir, are you okay? Call 911. Get an AED and first aid kit right away.
Yeah, we have this at the store. Dad!
It's okay. He's calling 911. Did your father complain about anything before he collapsed, or?
He was complaining about not feeling well, but he always complains, and then he just collapsed out of nowhere.
Do you know if he's allergic to anything?
Allergies. Aspirin. He's allergic to aspirin.
Does he take any medication, or?
I don't think so.
I realized that video was a little bit joggy, but every time I show a video in a lecture, I will put that directly into the module so you can reference it if you need to. So some of the questions that we want to ask ourselves after watching this video is what alerted the bystanders to the fact that an emergency was occurring? So there's a couple of different assessments here. First of all, it's his daughter yelling for help, right, after the man collapses. But if we take it the next step, what were some of the observations that might have signaled an emergency? The gentleman saw the man start to look funny, right? He was sweating. He didn't look like he was all there. And so they were already starting to be concerned, okay? Now, the next step is, what are some of the roles that the bystanders took? You'll notice that some people continued to walk by, right? And maybe it's 2 reasons: negligence, where they have a skill set or a certification, but they choose not to use it, or they don't have a certification, and so they can't deliver care. But as far as some of the other roles that took place, you'll notice that the gentleman that ran up, he started to do what we call a patient assessment, which we will get into in another module, and asking all the right questions to know what's going on. The other man started to use his phone to call for EMS, call 911. It was very specific and direct. Another bystander was someone who worked at the store, who brought the AED and was going to be a supportive participant in the man's care. So deciding to take action. At the scene of an emergency, decide To take action is not always as simple as it sounds. So why might someone be hesitant to respond to an emergency? Some of it, like I just mentioned in the last slide, has to do with your abilities, whether or not you feel competent enough to help. Maybe the scene is not safe. Maybe we're in the middle of a pandemic and you see someone collapse and you don't want to take their mask off and your mask off in order to treat this patient or person who has collapsed. So what's the difference here? Responders are rarely sued for helping in an emergency. So that's something that is fairly uncommon, that something would happen. Now, there's obviously horror stories about people being sued after saving someone's life in the grocery store or something like that. But even if that does happen, there's something called the Good Samaritan's Law, which means that if you practice care within your capabilities and within your certifications, so by the end of this class, if you have a certification and receive a certification, you'll have a certain range of skills that you are allowed to perform. As long as you are doing everything to the best of your care, Good Samaritan's Law will protect you. Always obtain consent before giving care. This is the second step to protecting someone. So even if something is happening or a child collapses, if you request from the parent or guardian that you would like to give help and you tell them what your certification and level of experience is, if they say no, you can't help them. Okay? We'll get into more details of that shortly. So, deciding to take action. Activating the EMS system is the first part of taking action. So there's a rapid arrival. And so this, again, is the difference between front country and back country care. So some of this crosses over, but like I said, we're going to go deeper into a wilderness setting when we get to the wilderness first aid, and I'm going to backtrack on how this relates to what we've already covered. So rapid response is EMS personnel increases a person's chance of survival. Takes anywhere from 4 to 7 minutes typically to have a first responder attend or get to an emergency situation in a front country setting. In a back country setting is considered anything that takes an hour or longer. We activate this by calling 911, and we do this by being very specific and direct with the information that we give EMS. The more information they have before they get there, the better chance of survival of the participant. Activating EMS. When we activate EMS or call 911, right? Life-threatening conditions. So if a person is unresponsive, automatic 911. An altered level of consciousness. So someone is not able to answer questions, doesn't know where they are, what year it is, things like that. Any sort of breathing problems is an automatic call for 911. Any severe external bleeding, vomiting, or passing of blood, and signs and symptoms of life-threatening medical conditions such as a heart attack or a stroke. Okay? In addition, any sort of severe or critical burns, we will get into burns when we talk about first aid and what percentage of the body is considered a critical burn. Any obvious head or neck injury or spine injury, any suspected or obvious bone breaks. So if you see a broken bone or it has punctured the skin, it's an automatic call. Any sort of poison or life-threatening poison, a child swallows chlorine or bleach, something to that effect. And anytime that someone has a seizure, we want to automatically call 911. Giving care until EMS takes over. It is your responsibility once you have a certification that you continue to give care until emergency response arrives. This is slightly different in a wilderness setting in that you can only give care as long as you can before you are now in danger. Okay. Consent is always implied if the person is unresponsive or mentally impaired, okay? And a minor with a life-threatening condition if a parent or guardian is not present. So again, like the example I said in the previous slide, if a minor is choking and a parent tells you, no, you cannot help my child, there's nothing that you can do while the parent is present, okay? If the person is awake and alert and does not give consent, you cannot give care, but you still should call EMS if it's one of the life-threatening emergencies. Let's go ahead and watch this video for clarification.
Now that you have recognized an emergency and decided to take action, follow the emergency action steps. Check, call, care. Before rushing to help an injured or ill person, you need to check the scene, so stop and look around. By answering the following questions, you will gain the information you need to proceed. Is the scene safe to enter? Hazards such as fire, spilled chemicals, and traffic, to name a few, could endanger you or any bystanders. If the scene looks unsafe, stay clear and call 911 or the designated emergency number. What happened? Check for clues that might tell you the cause of the emergency. How many people are involved? In an emergency with more than one injured or ill person, you may need to prioritize care. What is going on with the person? Form an initial impression about the nature of the person's illness or injury. If you see severe, life-threatening bleeding, take action to control the bleeding using any available resources. Is anyone else available to help? Bystanders may be able to provide valuable information about the situation or the person, along with getting needed items, controlling crowds, and reassuring the injured or ill person. Once you've checked the scene, you need to check the person. If you are not sure whether a person is unresponsive, shout using the person's name if you know it. If there is no response, tap the person's shoulder and shout again while checking for normal breathing. Check for responsiveness and breathing for no more than 5 to 10 seconds. If there is no response, shout using the person's name if you know it. If there is no response, tap the person's shoulder and shout again while checking for normal breathing. Check for responsiveness and breathing for no more than 5 to 10 seconds. If there is no response and the person is not breathing or is only gasping, the person needs help right away. This brings us to the second emergency action step, call. Unresponsiveness, trouble breathing, and severe bleeding are all signs of a life-threatening emergency. If your initial check reveals these or any other life-threatening conditions, make sure that someone calls 911 or the designated emergency number right away. The final emergency action step is to give care according to the conditions that you find and your level of knowledge and training. Always remember, check, call, care, and you'll be ready to respond to any emergency.
Check, call, care. Make sure that you evaluate that. But again, before rushing to help, size up the scene for your initial impression. You have assignments for sizing up the scene, 3 assignments where you're going to ask yourself critical questions, such as the below questions. Whether the scene is safe to enter. You're going to explain why that is or is not safe to enter. Okay? What happened to cause the emergency is the question that you want to ask for yourself. Is there some sort of hazard that puts you in danger? How many people are involved? Then you have to start looking at things like triaging. Do I need help? That might signal that. What condition is the person in? And is the person alert and active? Is it a sprained ankle, right? Things are going to be different depending on the situation. Whether anyone else is available to help is going to be the next phase. Okay? As part of your initial size up, things that you want to ask yourself. Does the person appear ill or have any immediate injuries? Okay? Is the person moving or motionless? Does the person have signs of life-threatening injuries, right? Because that's going to give us the information we need of whether or not to call for help. A lot of these things you're going to be asking yourself anyways, but the reason that we're covering them and they seem like such an easy thing is if you start to look at all of the energy and everything that goes into a stressful situation, sometimes we can overlook these questions that we would think about in our normal daily life. Okay? Check, call, care. Based on your scene size up, then you will decide, do I need to call 911? Do I need to get an AED and first aid kit? And do I need to provide any sort of care for this patient that is within my abilities? Okay, is the scene safe, right? What happened? All of these same questions. I recommend taking a little screenshot of this as it will help you with the quiz and your assignments as well. Okay, if you're alone and there is no one to send, right? So that example that we watched earlier in this lecture, he said, call 911 to his friend. If you're by yourself, do you call first or do you give care first? All right. So anytime when it's a cardiac arrest or we have a reason to believe that it's heart related, we want to call first. If it's any sort of situation like breathing or life-threatening bleeding, then we want to care first. So to go a little bit deeper, you call first if any person 12 years or older who is unresponsive, okay? You're gonna call first if a child or infant suddenly collapses, and you're gonna call first for an unresponsive child or infant who may also have heart problems. Okay, you're gonna give care first if any unresponsive infant or patient younger than 12 years, and the reason is that they're more likely to bounce back without the care of EMS. You're going to care first if the person is choking, because you can step in and assist that person before things get too bad. And when a person is experiencing any sort of severe allergic reaction like anaphylaxis, you're going to want to administer something like epinephrine, right, an EpiPen, prior to calling EMS, because that's going to be the greater chance of that person's survival is that. We're not going to cover EpiPens and epinephrine. We can't do that in a virtual setting, and in California you need a special certification in order to deliver someone else's epinephrine. Okay? A person who is experiencing life-threatening bleeding, you are going to give care first. Finally, you want to lower your risk of infection by carrying what we call as PPE, okay? So that's personal protective equipment. After this class, it's going to be a strong recommendation that you carry some sort of PPE with you at all times, because you're going to be required to perform help with people that is within your expertise. For the sake of this class, you don't have to have gloves, but I want you to wear rubber bands on your wrists, and every single time that you perform a scenario that you are doing a video recording of, you are going to snap each wrist's rubber band to show me and simulate what it would be like in order to put your gloves on. It's recommended to use latex-free gloves because latex is such a common allergy these days and can cause a bigger problem or an additional problem when trying to serve someone. And you want some sort of CPR breathing barrier should be included in your first aid kit. There are keychain options for this. I keep a CPR mask in my glove compartment at all times and anytime I'm in the backcountry. Good luck on your quiz and your following assignments.